Welcome to Raaonline. Today's topic is hemolytic anemia in pregnancy. Hemolysis may be primary disorder, and sickle cell disease and hereditary spherocytosis are the examples of hemolysis. Now, hemolysis complicates an underlying condition such as systemic lupus erythematosus or preeclampsia can be there. Microangiopathic hemolytic anemia from malignancy has also been reported in pregnancy. Autoimmune hemolysis, the cause of aberrant antibody production is unknown in autoimmune hemolysis. Both the direct and indirect Coombs test or antiglobulin test will be positive. Anemia caused by autoimmune hemolysis may be due to the warm active antibodies in 80 to 90% of cases, or cold active antibodies, or a combination of the warm and the cold active antibodies. Now, these syndromes of autoimmune hemolysis syndromes may be classified as primary, which is idiopathic, or secondary due to an underlying disease or other factors. Now, examples of secondary group include lymphomas and leukemias causing autoimmune hemolysis, connective tissue diseases and infections causing autoimmune hemolysis, chronic inflammatory diseases, and drug-induced antibodies causing autoimmune hemolysis. Cold agglutinin disease may be induced by infectious etiologies such as Mycoplasma pneumonia or Epstein-Barr viral mononucleosis. In pregnancy, hemolysis can be markedly accelerated. There is a role of low-dose rituximab Truxima tablet, which is 100 mg weekly for 4 weeks coupled with prednisolone, and this is the first-line treatment for autoimmune hemolytic anemias. Coming to drug-induced hemolysis in pregnancy, now these hemolytic anemias must be differentiated from other causes of autoimmune hemolysis. Subsequently, avoiding the drug is a preventive step. And one mechanism is hemolysis induced through drug-mediated immunological injury to red cells. Now, if these drugs bound to a red cell protein, the drug may act as a high-affinity hapten to which anti-drug antibodies will attach. And the same is the mechanism of autoimmune or drug-induced hemolysis caused by alpha-methyl dopa, and alpha-methyl dopa binds to the red cell protein and it acts as a high-affinity hapten to which anti-methyl dopa antibodies will attach. So that is why drug administration causes RBC hemolysis. And some other drugs which can cause drug-induced hemolytic anemias include probenecid, quinidine, which is an anti-malarial. Rifampicin can cause drug-induced hemolysis, and these drugs act as low-affinity haptens and they adhere to the cell membrane proteins, and after having attached to the RBC cell membrane protein, they induce hemolysis because they attract anti-drug antibodies. Now, there is a disease called as pregnancy-associated hemolysis. It is an unexplained severe hemolytic anemia which can develop during early pregnancy and it resolves within months of postpartum. Now, clear immune mechanism or red cell defects are not contributory for pregnancy-associated hemolysis because a fetus neonate also may demonstrate transient hemolysis and immunological cause is suspected. Now, maternal corticosteroid treatment is often but not always effective. Mild microangiopathic hemolysis anemia in pregnancy with thrombocytopenia is relatively commonly associated with severe preeclampsias and eclampsias. Now, there are other conditions which are associated with pregnancy-induced hemolysis, and they are acute fatty liver of pregnancies, and acute fatty liver of pregnancy can cause moderate to severe hemolytic anemia associated with pregnancy.